Hi, I'm Chelsea Gorsline, a second-year infectious diseases fellow at Vanderbilt University Medical Center. Today I'm sharing work from CASANET, the Caribbean, Central, and South American Network for HIV Epidemiology, in which we examine the effect that earthquakes have on the continuity of HIV care at our clinical sites. CASANET is the Latin American regional member of the IDEA network and includes sites in Argentina, Brazil, Chile, Haiti, Honduras, Mexico, and Peru. Natural disasters, such as earthquakes, occur frequently in this region and are typically associated with structural and financial damage, but they also negatively impact morbidity and mortality, particularly in those who have chronic medical conditions. Despite classification of HIV as a chronic condition and knowledge that disruptions in care lead to worse outcomes, little is known about the impact that natural disasters may have on HIV care continuity. We therefore sought to quantify the impact of earthquakes on HIV care at CASANET clinical centers. Data were collected from the United States Geological Survey, the USGS, for earthquakes considered to be of moderate intensity and centered less than 300 kilometers from a CASANET clinical site between January of 2000 and June of 2018. Geographic information shapefiles were extracted from the USGS, and a shake map was then constructed for each earthquake, with the CASANET location superimposed. An example is shown in the figure here. 4 moderate to high-intensity earthquakes were identified that affected sites in Mexico, Peru, and Chile during the study period. Patient data for 6-month periods before and after the associated earthquakes were collected from the sites. We examined 4 outcomes: number of clinical visits, CD4 measures, viral load measures, and ART initiations per person per week. Interrupted time series models with discontinuities aligned at the date of the earthquake were fit. These were Poisson regression models using the number of patients in care as the offset, modeling the rate of outcome based on weeks since the earthquake. We also calculated incidence rate ratios for each outcome over 3 and 6 months for both near and longer-term effects. Using a 3-month window pre- and post-quake, we observed a significant immediate drop in the weekly rate of clinical visits with an incidence rate ratio of 0.79. There was also a significant drop in the weekly rate of viral load measures with an incidence rate ratio of 0.78. While CD4 measures and ART initiations declined immediately following the earthquakes, these were not statistically significant changes. Using a 6-month pre- and post-quake window, we saw significant drops in the weekly rate of clinical visits with an incidence rate ratio of 0.66 and of viral load measures with an incidence rate ratio of 0.42. In addition, there was a significant drop in the rate of CD4 measures, which was not observed in the 3-month model, with an incidence rate ratio of 0.43. The average weekly rate of ART initiations declined, though this, again, was not a significant change. In Figure 2, the outcomes from the fitted ITS models are illustrated against the counterfactual trajectories, which is the expected trajectories in the post-quake period had there not been an earthquake. Sharp drops in the rates of each clinical outcome immediately following the earthquake discontinuity, moving from left to right, are apparent in all panels, though slope changes at the time of the earthquake are more apparent with a 6-month window, which is shown in blue, than a 3-month window, shown in red. Slope changes for clinic visits, CD4 measures, and viral load measures all indicate recovery following the sharp drops which ensued after the earthquakes. In conclusion, our longitudinal analysis of regional earthquakes showed an appreciable impact on the continuity of HIV care when comparing post- to pre-quake periods within CASANET clinical care sites. There were significant drops in clinic visits and CD4 measures in the 3-month post-earthquake window, and significant drops in clinic visits, CD4, and viral load measures in the 6-month post-earthquake window. There was also non-significant decline in ART initiations. But despite these declines, there was a steady recovery in the months following an earthquake, suggesting that most clinics were able to recover pre-earthquake functionality. We feel that our work speaks to the need for Latin American sites to create flexible contingency plans to mitigate the impact of future natural disasters on HIV clinical care. I'd like to thank Dr. Peter Ribeiro, Sarah Lotsbeek, Dr. Kathy McGowan, and the other CASANET members who have contributed significantly to this work. And I'd also like to thank you for coming to watch my talk today.